Good afternoon, everybody. I hope you're all doing well. Happy start to your summer. I hope you're getting a little bit of a break, or you at least have one on the horizon. It's time to recharge and enjoy the weather and really recommit to the work that we do. So I'm particularly excited to invite you. I guess I should say this. I think you all know I'm Michelle Zabel from Innovations Institute at UConn School of Social Work, and we're always so happy to partner with the National Council, particularly on the CCBHC National Training and Technical Assistance Center. Today, we are here to talk about establishing CQI, continuous quality improvement with fidelity and quality monitoring. And all these sessions are near and dear to my heart as someone who cares deeply about implementation science and installation of improved practices. I have to say, honestly, CQI, fidelity, and quality is like one of my favorite topics because it's so practical and leads people to improving outcomes for the folks that they've prioritized as their population. Centers are here to talk to us about establishing CQI systems with fidelity and quality monitoring. The colleagues that we've invited are people that I know have worked deeply in this space for a number of years. And so I don't normally read bios, but I want to read them for you so you get a sense of the depth of knowledge that they have in this and the amount of work they do directly with providers. So Dr. Jill Farrell, I've had the honor of working with like close to 15 years, I think. She's research assistant professor at University of Maryland School of Social Work, deputy director of research and evaluation for the Institute for Innovation and Implementation. And her background and research interests really concentrate upon improving experiences and outcomes for youth involved with child and family serving systems, particularly the juvenile justice and child welfare systems. She's been a primary research partner to Maryland Department of Juvenile Services for over 20 years. Collaborating, developing, implementation, and evaluation of case management practices, assessment tools, and programs for youth. And then she's got a little additional about her evidence-based practice experience, but let me say that Jill and I co-established Maryland's Evidence-Based Practice Center, which now has almost 20 EBPs that they're evaluating on a regular basis and using CQI and fidelity and quality outcomes monitoring. So her depth of expertise in this area is quite substantial. We're also happy to have Leah Bartley here with us today. She's a social worker with over 15 years of experience in direct service, philanthropy, and academia. And most recently, she was a senior implementation specialist at the School of Social Work at UNC Chapel Hill, where she has supported the application of implementation science in child welfare, early childhood, and philanthropic initiatives. She's a Doris Duke Fellow for the promotion of child welfare, child well-being, and at Chapin Hall, at the University of Chicago, and she provided TA evaluation and implementation support to the replication of Family Connections, which, for those of you who don't know, is a child maltreatment prevention program at the University of Maryland, Baltimore. She was a Duke Endowment Fellow. And she values the importance, as all of you do, of relationships and trust in implementation and evaluation efforts. And I will say that we cross paths at University of Maryland, and so I'm super excited she's here to present as well. And then Jaymie Lorthridge, who is a senior research associate at Kaye Associates. Jaymie, I'm just so happy Jamie's here. She's worked for over 20 years on behalf of communities and families, and her background, you've got like a JJ person and a social worker, and Jaymie started out as a uniform patrol officer, observing the social determinants that dictated citizens' quality of life. So she transitioned to a career in research and evaluation to build evidence for strategies that can improve outcomes for systems impacted communities and families. And now prior to joining Kaye Implementation Associates, she was a senior study director at Westat. She brings a participatory perspective to her work, engaging stakeholders at multi-levels as partners throughout all stages of the project. In collaboration with multidisciplinary teams and through partnerships with stakeholders, Jaymie designs and implements processes and mixed methods outcomes that support data-driven decision-making and inform program implementation and policy improvement. policy improvements. Her social work education and training in culturally responsive and equitable evaluation methods informs the research questions and outcome indicators she proposes. So I said this to you each time. I've actually tried to bring SMEs who might be good partners on some of these. So like you have met a series of people who do this type of work regularly. So it wouldn't be beyond the pale for you to email them after and be like, hey, would you like to be a research partner? I can't promise that they'll say yes, but we are trying to introduce you to people who would be good partners in this space as well. So with that said, I'm going to hand it over to these guys and we'll go from there. I'll see you at the end. And now you guys have to take over your own learning objectives because of how I did it. Okay.
That is fine. Thank you, everybody. I'm Jill Farrell, and I'm going to kick us off with the learning objectives for today. So the point of this session is to provide you with some foundations and tips on setting up CQI systems for your programs, as well as how to partner with the researcher to install that process or research that process, et cetera. So specifically the objectives for this session, participants will explore key concepts of continuous quality improvement systems and how research partnerships can support the process. Understand how implementation teams that include research partners can support CQI system development. Understand how to prioritize data elements for your CQI systems in partnership with researchers. Understand the types of data included in CQI systems and how they can benefit your team and researchers. And understand how implementation teams use data to advance equitable outcomes. Thank you, Gary. So we'll start with the definition of continuous quality improvement to make sure we're all in the same place. CQI is an ongoing effort to achieve measurable improvements in the efficiency, effectiveness, performance, accountability, outcomes, and other indicators of quality for programs, systems, agencies, et cetera. So the word continuous implies that you're putting into place something that is routine or systematic in developing a process that's going to be embedded within your agency and done on an ongoing basis to support your program efforts. It's even with programs such as evidence-based models that have very well-defined components, these CQI processes to help support your implementation are very important to make sure your investment in the model or evidence-based practice is achieving what you're hoping that it will for your population. Even the most manualized program can drift from what was originally defined, given that you're operating in very dynamic environments that have a lot of system pressures. So the probably two things to stress here before moving to the next slide is the importance of two important aspects or important aspects of effective CQI systems involve teams and data. A CQI process cannot be carried out by a single person, such as the data person who's compiling all the information. It's really got to be compiled for the sake of use by teams to do the system improvement efforts. And of course, we want to couch it in data. And we're going to talk a lot about that in the following slides. So next. This slide shows you a CQI conceptual framework developed by researchers at the Urban Institute in supporting their efforts or supporting researchers working with Head Start programs. They did a very thorough review of the system or organizational factors that support effective CQI processes. And I think they've done a wonderful visualization here of how to best set this up in your agency. So at the top, you'll see the pretty traditional cycle that represents a CQI cycle or process and the various steps that look usually similar across the various CQI approaches. But what's important about this is for these processes to be effective, they're embedded in agencies that have these strong pillars and with a foundation in which leadership embraces and cultivates a culture that is focused on data improvement, use of program improvement, use of data, empowers people to make decisions and use data. And that's represented in the pillars that are kind of supporting the roof with the CQI process. So to do CQI, it requires a use or commitment of time, ideally by leadership. I find in CQI processes that leadership engaged, the team will tend to go for the harder things to tackle because they've got the decision and support and resource support at the table to help devise those strategies to tackle the issue. The agency needs to have, with leadership support of a good data system or approach to be able to collect the data, as well as the capacity by the team to analyze and report on the data, as well as the investment in the rest of the team to be able to understand and use it in terms of their work. So creating a space for people to build skill sets and understand their role and how to use information in program improvement. And the only other thing I'll note to move it along is the importance of creating a safe space in kind of that the bottom of the roof under the next to culture of collaborative inquiry. The continuous quality improvement implies that you're going to look at data and identify things that aren't going well. And it never feels great to be part of something that's not going well. But ideally the folks at the table are going to feel comfortable sharing their experience of why it's playing out in that way and what are the contributing factors that they're aware of that are playing into this process, so that it's open and you can get to the underlying causes of what's going on. Without that safe space, there's, often people are coming to this table for fear of being penalized, and they're not going to open up about what's really going on, but then you won't get to the root of how you're going to fix it. I think I'll just leave it there for now, and we'll move to the next. Okay. Leah?
Thanks, Jill. Hello, everyone. Happy to be with you here today. So one of the things that we wanted to kind of make a connection about was that as you're thinking about a research partner or talking with research partners, there are implementation frameworks that can not only guide that research study or how that researcher might be thinking about the study, but also might guide your EBP implementation process and CQI process. And so we really saw that as an opportunity to make a connection between kind of your process in supporting that evidence-based program you're selecting, how you're thinking about CQI and what components you might be looking at, and how your research partner might be connecting into some of that work. And so these are two frameworks, the Consolidated Framework for Implementation Research, or the CIFR, and also the PRISM model that are often used in implementation research. There's a lot of really great resources out there on these frameworks. CIFR, for example, has a great kind of user-friendly website that actually goes into each of the domains of the model. So you see in that figure there, the CIFR identifies kind of outer setting factors that can influence implementation, inner setting components, things about the implementation process. So how the implementation process is going, like teaming, assessing needs, planning, and then also aspects of the evidence-based program itself. And so how that's selected. And so it really kind of outlines these key features of the implementation process that might be helpful to you as you're thinking about implementation, but also your research study. And so we wanted to make that connection for you all, that as you're thinking about your research partners or even some of your research questions, really thinking about and aligning some of those efforts really could benefit how you go about kind of improving your implementation, but also kind of what you learn in the implementation study process. Next slide, please. We also thought it might be helpful to do kind of a quick peek into kind of the literature and research around CQI in and of itself. And so this paper summarizes, is a systematic review of 28 randomized controlled trials to test the effectiveness of kind of different approaches to continuous quality improvement compared to non-continuous quality improvement efforts. And just to kind of caution with this, they did find kind of some limitations in doing that because it's not as easy to implement an improvement process and then kind of a controlled environment where there's no improvement processes going on at all. So just want to caution that. But in this review of randomized controlled trials, there were two kind of most commonly used frameworks that might seem familiar to you or you have heard of. One is the Plan, Do, Study, Act, and the Model for Improvement, also another kind of CQI framework that were most commonly used. Across the studies, they really saw clinical processes, measures they saw improvement in, and so really saw the benefit of implementing CQI efforts in improving how clinicians and staff were implementing kind of their practices or evidence-based practices if we're thinking about kind of your context. Also, in this review of the literature, leadership involvement really increased the impact on outcomes. So there was a benefit in terms of how these projects or organizations structured their CQI process to either include leadership or connect with leadership in their improvement efforts. And then meeting frequency. For example, meeting kind of weekly or bi-weekly really increased the impact of those positive effects of the CQI process. And so this really connects well with some of what we're going to talk about in terms of structuring your CQI process, but just wanted to kind of give a nod to some of the research supporting the benefits of a CQI process. And I'll pass it to Jaymie.
Thanks, Leah. I'm excited to be with you all today. And as we're thinking about effectiveness of CQI processes that have been implemented, it's also really important to think about the ways in which continuous quality improvement can promote equitable outcomes. And there's an if here that's not on the slide that I'll lift up. And the if is, if the CQI stakeholders have developed a clear definition of equity. Far too often, equity becomes this thing that we know it when we see it, but to get to those equitable outcomes, we have to all be operating from a place of shared understanding. And one of the big conversations that's been happening around equity is the difference between equality and equity, and the ways in which then you go about achieving equitable outcomes when you understand that difference and you're focused there. So you see these two images are a juxtaposition of what equality might look like in practice and what equity might look like in practice. So on the left, where we're talking about equality, that is a scenario or an ideal situation where all three figures who are climbing up those long ladders are going to reach to the top to get, in this case, this is coming from an education publication, so they're reaching for that diploma. And they all have the same thing, but it doesn't mean they're going to get to that diploma. Just providing that ladder is no guarantee, but that's where equality rests, in providing the same thing to everyone. If we pivot, though, to the figure on the right, where we're looking at equity, that is all about redirecting resources on an individual basis. So that ladder on the right, if you may or may not be able to see it on your view, but it's starting in a sinkhole. There's this hole at the very bottom. And so this person's having to even climb out of the hole to even get on the ladder. And along the way, there's these structured supports that are provided by the people who are in the truck, strengthening those rungs in different areas that are specific to the need of the person who's making that climb. That is equity. Equity requires customized solutions that are based on the self-defined needs of the service recipients, not what practitioners, professionals, subject matter experts, not what any of us think people need, but what people themselves say they need, which means, there's another if that's not there. If we ask them, then we'll find out what they need. So we have to engage in that process of asking them when we're trying to understand what equitable outcomes might mean. That has to be also an inclusive process where we're not privileging certain voices and certain perspectives, but we really are trying to understand the breadth of our client and our service population and the needs that they all bring with them and the different situations in which those needs might arise. And then the other aspect of equity that we can see in this figure on the right is collectively working together as a system to make change. And so it's another term that comes up when you might hear discussions of equity is systemic equity, and how you might be able to move from individual level equitable outcomes to pivoting to a system then that is scaling up solutions that meet the needs on an individual basis. Then you're working on a level of systemic equity. So really starting at that basic fundamental place of clear and shared definitions is key to equity. And one of the things that you all shared in the mentees, and I echo Michelle's thank you, it's really helpful to get your reflections and your responses there, is in terms of sharing information back with your agency from these webinars. And this is a great one. All of this is great content to share back with your agency, because everyone has a role to play in ensuring equitable outcomes. And implementation teams in particular have a key role in continuous quality improvement work and ensuring that those plans and work can focus on equity. So we're going to talk a little bit more about that in the next slide. So implementation teams, and in terms of their role in CQI, overall, an implementation team really useful for moving a program or a policy or a practice forward, even from the very first stage when a program or policy or a research project is being developed or selected. But in terms of an implementation team's role in CQI, they have a unique way to help move the CQI work forward. And also, another reflection that you shared was getting ready to partner with a researcher and wanting to know more about how to start that partnership. Well, your implementation team, if you have one, can really play a key role in getting ready for that partnership. So we'll talk about collaboration in the next slide. So these are a couple of responsibilities that implementation teams have in CQI in particular. And you'll see that we start with developing and supporting and overseeing that implementation plan, and in particular, making sure that as the plan evolves, then the CQI processes are responsive to the iterations of the plan, so that you don't come out with this refined implementation plan, but a CQI plan or process that's a few steps behind. So they can bridge that gap sometimes that may happen in between practice and then CQI planning and processes. They're also wonderful champions for improvement efforts. And because they are up to date on what may be happening and what the needs may be around continuous quality improvement, they're your go-to people when you're trying to secure resources based on the data that's emerging from the CQI process. And this is also, as I mentioned, one way in which your implementation team might help you partner with the researcher, or especially around funding. There are different funders out there who focus on different populations. And so if your CQI implementation team is really knowledgeable about the data and the needs of your population, they can help to use that data in those funding applications. They're also really critical for addressing implementation barriers and identifying opportunities for improvement, because they're bringing that real-time data to discussions about how the implementation process is going and planning for sustainability all along the way, thinking about if we're going to collect this data, if we're going to have this process, are we going to have the staffing, are we going to have the resources continuously available to be able to do this for the life of the program or the project? And then these last two aspects, in terms of their responsibilities and roles, are also quite helpful for bridging gaps. So with their focus on including and incorporating youth and family perspectives on barriers and opportunities for improvement, they can take that data that's really important alongside your other outcome data, and they can take that and bring it forward for planning purposes. And then altogether, collectively, that data can be used to make informed decisions, and ideally in partnership with your research partner. And that's a very sustainable and clear pathway to getting to improved outcomes. So we go to the next slide. You'll also see that the implementation team has some responsibilities if you're going to try to focus your CQI process on equity as well. So the items in blue on this slide are in addition to what we just went over in terms of team responsibilities. So making sure that that CQI plan has some equity objectives embedded in it and is responsive to changes in equity objectives. And hopefully, as improvements are happening, those objectives are being revised and refined. And as a champion, making sure that there are some resources that are set aside to promote that continual involvement of persons with lived experience. Because if you're going to commit to that meaningful partnership to get the youth and family perspective, you want to do that on an ongoing basis to make sure that you're aware of when needs might change or when the expression of needs might change. They can use an equity lens when thinking about implementation barriers. So is this a barrier for this particular client subpopulation or that client subpopulation? And also in sustainability, how are we going to approach sustainable power sharing? So if we are engaged in decision-making processes with our client population about how services should be selected, delivered, improved, how can we sustain that co-decision-making process? And then I will turn it over to Leah to talk a little bit more about the implementation stages that the team can lead the organization through.
Thank you, Jaymie. Yeah, that's so great to just see that so explicitly related to equity in those team activities. So one of the things we know too is that the implementation team helps kind of shepherd the evidence-based program through the implementation stages. And you all heard about kind of using that implementation stages planning tool last session. And so one of the things that we wanted to acknowledge is that the implementation team can be thinking about kind of some key questions through the stages that might be considered through your CQI process. And these are things that you can coordinate on with your research partner. So your research questions might be related to, in some ways, in terms of where you are in that implementation process. And so just to reflect on the exploration stage, so when things are kind of getting started or you're thinking about what you might be doing, I think there's some animation on this slide, so you might need to advance that for me. Some key questions that you are thinking about, that you might be thinking about in exploration are what are the needs and assets of the individuals and families we serve? How do the behavioral health programs fit with those needs and goals? Is there buy-in among key partners? And some of the kind of key implementation outcomes that relate to that exploration stage and process, if you could advance this next piece, are feasibility, acceptability, and appropriateness. So when we've done exploration well of the programs that we're considering, and there's a match between that program and kind of the needs and assets in the programming, it will be feasible for us to implement. It will be acceptable for the individuals and families we serve, and appropriate in the context that we work in. And so those are some outcomes of exploration, again, that you might be thinking about in the implementation process, but also might, might be things to consider as you think about kind of your research questions and working with a research partner. In installation, so as you're kind of developing those resources to begin to implement the evidence-based program, you're thinking about how can we assess, secure, and develop the resources needed to put the behavioral health program into place? How can we leverage implementation infrastructure that we currently have to support implementation? And how can research partnerships strengthen our learning and improvement process? So how can we design our own kind of teaming or CQI structure to support initial implementation of this evidence-based program? And so here, when we're doing installation well, we're seeing that adoption, so that uptake of the evidence-based program, that folks feel prepared and equipped to go and implement this behavioral health program, and we see readiness. And so just want to acknowledge those kind of key aspects of kind of the preparation stage, or installing those key infrastructure components for the behavioral health programs. When we think about initial implementation and when you're really kind of getting started with implementation, some things you might be thinking about in the CQI process might be, how can we support practitioners learning the new program or using a familiar program in a new context? So what do we need to be paying attention to as folks are getting started or beginning to implement this in new ways? And what sorts of data and questions do we have about that? And what data can help us improve those supports of behavioral health program? So when we receive data back, what is it telling us about the implementation supports we have in place or that we might need to refine? So things like, how can we feed this back to coaching and supervision? How can we feed this back to leadership and in ways that can support practitioners' ability to carry out some of this information? So again, just thinking about these stage-based questions and how they might influence your CQI process. Here are some of those outcomes we'd want to be thinking about. Those implementation outcomes relate to reach. So are we reaching the individuals and families we are intending to serve? Are practitioners and staff able to implement with fidelity? And we'll be talking a little bit more about what that means. And what are the costs? So do we have an idea of how much kind of the cost of implementation is going? And are we seeing some cost benefits as we think about the implementation process? And then lastly, when we think about full implementation and when we've seen some stabilization in terms of how things are being implemented. So practitioners or staff are kind of able to implement that behavioral health program kind of across many cases. Over time, we're seeing outcomes be experienced with the individuals and families. Questions we might think about in the CQI process: are we experiencing sustained use of the behavioral health programs, with most practitioners delivering the model with fidelity and ease? Are programs reaching the intended population? So there, we're really trying to connect the fidelity and how the program is being implemented to those outcomes that they are experiencing. And so again, some of those stage-based outcomes we'd want to continue to assess are reach, fidelity, sustainability, and cost. And again, just thinking about how, the implementation stages can serve as also, a way to kind of think about where you are in your implementation process and how that connects into your research study as well as your CQI process.
Thank you, Leah. And I'm gonna dive in a little bit now onto the specific elements of data that you're likely gonna want to have in place to ensure a kind of robust CQI process as possible throughout the life course of your program, and ways that researchers can help to also engage in this process. And you likely already have some aspects in place as you're getting going with implementation, but maybe there's some ideas in here and how you can enhance your model. Next. So this slide covers what we consider the necessary data elements to tell the story of your program. When working with new programs or existing programs, this is a slide I always rely on to talk about the buckets of how you're going to tell the story of how things are going. And to walk you through the first bucket, so to speak, I'll also note that other frameworks use similar buckets with different language, but kind of validating that this holds across different ways that people go about this. So go to the first one, capacity utilization. You're collecting data elements in this bucket that are going to help you answer the question of who and how many clients, participants, families, et cetera, are we serving? And ultimately also trying to answer the questions that Leah was just raising. Are we reaching the population that we intended to serve? Do we have the capacity, et cetera? The next bucket, fidelity implementation, is meant to help you assess how well is the program being implemented. There are a number of indicators here. They may not always be relevant to all programs, so that, working with a researcher and your CQI team, you can ideally pick what types of indicators help you get to what you need to know for each of the programs that you're implementing. We're going to speak a little bit more about fidelity in a moment, or Leah will get into that. So I'm going to keep moving here. The last bucket in terms of outcomes, obviously want to know how did our families, clients, et cetera, fare as a result of participating in our program. And so specifically looking at changes in behavior, skills, knowledge, whatever the program was designed to help impact, to set them on a course toward a more successful course. I guess maybe I'll just leave this here for the moment, looking at the time, and we'll move through to fidelity. I'll make a few more points later.
Thanks, Jill. So fidelity assessment is defined as indicators of doing what's intended. So is your evidence-based program being carried out as it was originally developed? And so that really requires knowing what is intended and having a way of knowing the extent to which a person did that as intended. So most evidence-based models will come with fidelity measures, right? And so understanding kind of what that measure is. Some also have multiple forms of measurement. And so understanding kind of what that measurement is and entails is an important aspect of connecting in with what you assess in your CQI process. But fidelity really is an important measure to understand kind of who's implementing what, what are clients receiving, and is that fidelity occurring, or is the evidence-based program being implemented with particular clients or across all clients? And it requires both adherence to the model, so thinking about how well it's being implemented as it was originally intended, as well as competence in the program delivery. So thinking about how well are staff feeling able to carry out this program kind of across cases. And fidelity standards and monitoring reduces the potential for model drift. So this really acknowledges that even if a practitioner has been implementing a program for quite some time, there can still continue to be model drift. as contexts change, as folks learn new ways of work, as as we think about kind of new cases evolve. And so fidelity is a really important kind of metric to think about in an ongoing way. If you could go to the next slide. So one of the things we did just want to acknowledge is that there are a variety of methods for assessing fidelity. And so here we've kind of included a list with a description of different ways to kind of measure fidelity. There's also some really helpful sites that actually have inventory of different fidelity measures for particular models. But again, acknowledging that most of the models you come with likely have fidelity measures. And so if this is something that you are interested in reflecting back on, this slide or potential resources related to different forms of fidelity measurement might be helpful to you as you're thinking about your CQI process and what works best. You can go to the next slide. And then one of the things we wanted to acknowledge is that fidelity measurement is going to be important to you as kind of an organization or really thinking about the implementation of your evidence-based program, but it's also important in terms of the research and evaluation or implementation study that you'll be thinking about. So fidelity measurement really can be used to support the implementation progress. It can be used to provide kind of concrete, explicit feedback to practitioners on their performance. And it can be really reinforcing. And there's actually some really nice data to support the protective effect when fidelity is used with practitioners, a protective effect on staff turnover. So less likely to turn over. That research came from Greg Ahrens in child welfare. So really acknowledging that fidelity, can support the implementation process and can be used to reinforce good practice so that, families can experience the intervention and receive the positive feedbacks that we're hoping for them to experience. Fidelity measures can also be used to support that research and evaluation strategy. So really critical when we're trying to understand, are the outcomes that we are experiencing because of the program we're implementing? That's what fidelity is really important for making that connection to. So as we think about some of these kind of key research and evaluation strategies, you see like understanding kind of the independent variable nature in the intervention research. So are the kind of specific components of our evidence-based practice really relating to those outcomes? Fidelity enables us to know that. So connecting the actual core program elements and components that are measured in fidelity to those specific outcomes. Okay, and you can shift to the next slide. And so this is one of the real kind of foundational studies of fidelity that really connected the benefits of assessing fidelity and their relationship with clinical outcomes. And so you'll see this study was actually almost over 20 years ago of functional family therapy, but really made the case for understanding fidelity as it relates to outcomes. So you'll see that adherent group with higher adherence, there was significantly positive outcomes. So that reduction in felony crime and a reduction in violent crime for that blue group. And then in the middle, there's the control group. So that was the comparison group and their outcomes. And then those that were non-adherent, so not carrying out the intervention as intended, actually saw a higher rate of some of those outcomes of youth who recidivated. So just want to acknowledge again and give some data here really on the benefits of measuring fidelity, both for kind of an implementation perspective, but also really for that research and outcome assessment perspective. And Jill, was there more that you wanted to add here?
No, that was great, Leah. Now we'll move into some practical steps that or considerations for you to review as you're either setting up your data system and or go putting this against your processes that you already have in place to see if there's areas that you can tighten up or improve. We'll talk a little bit more about developing a logic model in a moment, but that would be a kind of practical first step. Creating a data dictionary that aligns with for all of the data elements that you'll be collecting, and making sure that it's reviewed by multiple stakeholders, everyone involved in the process, and including those who are actually entering the data. So there's consensus on how they're defining what they're selecting to indicate how the program's going. Just a quick example there might be related to complete discharge data and reason for discharge, and making sure that your team's clear on when to select certain things and when they wouldn't apply in certain scenarios. So consensus on definitions is really key. Establishing data sharing agreements, MOUs, and consent forms if needed should be happening at the beginning of the process. Establishing a data collection and extraction process. We'll talk a little bit more about ways to collect data, but you'll want to have your procedure in place and how frequently things will happen. Included in that would be how the data will be monitored from a QA and kind of cleaning lens, and making sure that it's given you're going to use it in a continuous way, that it's staying usable for your processes. And then we'll talk about reporting. Next slide. Just very quickly, I'm sure most of you are familiar with logic models. They're a terrific visual snapshot of your program that communicates the intended relationships between program goals and outcomes and the theory of change. They consider inputs, outputs, and outcomes, and are your quick way to depict and have a conversation about what goes into the program, what people do to implement the program, and what you hope to achieve. It's an excellent place where you can intentionally center equity and making sure that you're clear on who you're going to be served and how they're going to be served, engaging people with lived experience and other stakeholders in the process to ensure a variety of perspectives are clear on how the model intends to operate and affect and impact lives. The practical goal is to get everybody on one page regarding the program and the approach. Let's go to the next slide. This is a template that we often use for setting up data collection for the lens of CQI. Very quickly, it looks like a traditional logic model template with inputs in terms of what you're investing, outputs, including what you do and who you intend to reach, and then outcomes. The one difference here that's not as traditional is the row related to the data measures. So what we do with providers is walk through the traditional logic model components in that kind of first blank row of inputs, outputs, outcomes. And then we go through and map what data do you have that can help us assess what's happening, how against the inputs, the activities such as the number of sessions, training, supervision, whatever the model requirements are that need to occur in order to implement as intended, who you reach, and then of course the outcomes. This helps the provider see the value, and I often get the question of why so much data, but because it ends up mapping to all these components and helps to tell the full story. A lot of times we're having to make decisions of, we can't collect everything. And so this is the most important pieces of each of these boxes in order to tell the story. And that in particular relates to outcomes. The outcome data can be typically harder to collect unless it's stuff that you're collecting as of discharge. So what we do is create a wish list and look for opportunities, such as when you're partnering with researchers on evaluations, for when you could potentially get data in that way to tell a fuller story of how your program's operating. Let's go to the next slide. Options for data collection, obviously, most of you probably have EHRs, and that would be the ideal place to have all of the, that really robust data related to utilization, fidelity, and outcomes built right into your EHR. To the extent that that's not possible, the low cost, easy to use approaches continue to be Excel and Access, or maybe Google Sheets, something that helps you, even if it seems kind of simple, maybe not for the long term, but allows you to collect data to get something going. The benefit of it's not built into your EHR yet, Excel and Access will give you a flexible means to get it right and get the right fields defined in the way that you'll know you need for CQI. Regardless, you're going to want to make sure that for your efforts, you're thinking carefully about what you're tracking, how you're tracking it, how you're making sure it stays clean and usable for ready use, and who is included and who is excluded in the data and why, so that when you're looking at the data from an equity lens, you are able to you're not unintentionally excluding something. Let's go to the next slide. Briefly on reporting, an ideal report is going to help you understand how your data or summarize data for your program capacity, fidelity, and outcomes, so that you can answer the primary questions intended at how things are going. These data should give you the view of what's going well and what needs your attention, and ultimately drive the strategies in the PDSA process that we'll briefly mention. Key design elements will be intentional about how frequently, plan from the beginning what you want to see, how frequently, use trends to the extent possible so that you can see how things are changing over time, especially given you're working in dynamic organizations, and then you're going to be implementing things intended to increase or decrease certain trends. Set benchmarks, very key, so that you have goals to work toward. Most DBPs will have some, but your team can create others to make sure you're working towards something for it to good, healthy functioning. And just a note, I could talk about dashboards all day, but they're key. They're a great investment if they're available to you. And they'll be a very efficient way for you to be able to view data on an ongoing basis. And I'll leave that there for now. Next slide.
Thanks, Jill. So just to echo Jill's recommendation about planning from the beginning, you want to plan from the beginning to tell a complete story. And in thinking about completion and thoroughness, you also want to think about telling an equitable story. So what data are you going to have available to understand how the program or project is functioning for all of the different populations that are involved in being served? And so this is a snapshot of a dashboard, and agreed with Jill, gosh, I love a dashboard. They are really great tools if you have access to them, and it's really exciting also to see the barrier to access getting lower and lower and lower as time has gone on in terms of low-cost tools and solutions and easy entry. You don't have to be a computer programmer anymore to do some of the dashboards that are available now. However, it is a snapshot. So you want to be prepared with other data and other information that provides context for the numbers. Being able to, if you're sitting in a planning meeting, you're looking at this dashboard, being ready with that contextual information so that you can help people understand the nuances of what it is they're seeing, especially if you have an internal dashboard and an external dashboard that you might share with other stakeholders and partners. You want them to be able to have the same level of understanding. And one way to really get a feel for how complete the story is again, continue that partnership with persons with lived experience, your service recipients, asking them, how are they interpreting this data? What are the headlines they have when they look at the data? There's something that we do on a regular basis that is just really beneficial. It's called data parties. And we ask and we partner with people coming into a session. We present data almost in a format like this. We call it a data placemat. or we might have one visualization at a time, and we invite them to tell the story of what it is they're seeing. And then we talk about what's missing and why, and how can we improve that data story. And then lastly, you want to understand if your numbers are aligning with those other sources of information. So if you've got satisfaction surveys, if you've got discharge surveys, if you've got other types of data that you collect that maybe isn't regularly visualized, but it does document client service experiences, how are the pieces of data integrating and talking with each other? Next slide. So in terms of prioritizing data, one big priority area that you can focus on, and especially when you're trying to tell that complete story, is disaggregation. So this is an example of a bar chart from a report that was focused on the health and socioeconomic well-being of LGBTQ women in the United States. And you can just see by looking at this bar chart, you get a much deeper understanding with this disaggregated data. This is disaggregated by race and ethnicity. You get a deeper understanding of how the different populations are faring in terms of their health and their socioeconomic well-being versus if you just had a bar chart that included everybody. So now you've got actionable data that you can use to go in and think about your equity objectives and outcomes. And if you are on the right-hand side, as suggested, collecting this data in a culturally competent and humble manner, and making sure that it describes the breadth of experiences, then you're setting yourself up to have this rich, disaggregated information that you can use to continue your planning. We'll go to the next slide. So just to bring everything together pretty quickly, we have this plan, do, study, act cycle where you can be using data regularly with your implementation team to think about all of the different stages here in this circle. So what data do we need to start our planning? Collecting that data, then moving on to the do stage, moving forward to the study stage where you're debriefing and you're reviewing the data, and then you're taking that time in the act stage to reassess your aims based on the data that you all have reviewed and worked on together. So we'll move to our last slide. So just want to acknowledge that we gave like an appetizer of a lot of topics. We could do a deep dive into all of these topics. We really could talk with you all day and appreciate your attention and your understanding. But our hope was that we gave you enough to think about, to bring back to your colleagues, to have those conversations with them, have those conversations with your research partner. If you're planning to obtain a research partner, these are some of the things you can still think about. So on this slide are points of collaboration that you can consider. Again, if you're still planning or if you're in the active stage where you do have that partner. So I'm not going to go through them all for the sake of time, because we really do want to know if you have any questions. But what I will add, or just sprinkle a few things in here, is if you're working with a research partner to identify those research questions, again, remember that you've got to bring that intentional focus on equity there. And that should be something that you're requiring of your research partner. You should be asking them, how do they go about equity focused work? If you're engaging with your research partner to assist you with measuring fidelity, you want to make sure that you're measuring fidelity for services that are provided to all types of clients, as Leah mentioned. And then if you're defining the data elements together, you want to ensure that you've got common understanding of program language, but also understanding opportunities to disaggregate that data. So we'll stop there and invite your questions, and we'll wait and see if there are any questions. But also, we'd love to know, for those of you who have engaged a research partner already, or maybe you're planning to engage a research partner, if you would like to share your experience with collaborating in any of the areas that are listed on the slide. Or maybe these are some areas where you'd like some more support, to the really good question earlier about how best you could get support in this environment.
Maybe we can pull down the slides. And then I know we just digested a lot of information, but a lot of really good information. And I have an inkling that a lot of you are quite familiar with some of these principles, but similar to us, probably are constantly thinking about how you can do them better in practice. So any questions coming up? Maybe
I'll ask a question or make a comment. So I think this is all really, really important for the CCBHC implementation. I'm a little hard pressed to see the relationship to the implementation science study, because unless you're studying CQI, I don't think you want to be mucking with the implementation during a study, especially these are going to be pretty short time frame studies. And so I feel like you'll just keep changing the intervention and you won't get any good results.
Go ahead, Jaymie.
Well,
I think we all have the same thought, so go ahead.
well, I just want to also say, Mary, I mean, I think you're right in that context, right? But I think also there was recognition at the beginning of this process that some CCBHCs might need to enhance their CQI process to even be ready to engage in the implementation science project.
Yeah.
And when we did that original survey way back in the day, CQI was amongst the top 3 things that CCBHCs asked for. So your point's very well taken. You can't mix the two, but I think part of what we're trying to say is, I mean, but you do mix the two, but like I understand that if you're going to like intentionally establish CQI, it may push your implementation science effort project back a minute. But in response to other kind of ask around CQI, this presentation was put forth to help. And honestly, because you have a time frame that is supposed to make this work for you, hopefully this is helpful to some CCBHCs. Like not everybody is obviously in the same pace. So just like in terms of the logic behind the why, but yeah. And then
I definitely see it to help people understand how to use their data, getting comfortable using their data, all of that. I think it's fantastic. So
which makes you as a CCBHC even more ready to engage with a research partner.
Right.
You know this, Mary, that it's harder when you're not even digging in your data as much as a CQI process forces you to do. So it's a bit translational in the fact that it's a stepping stone to readiness to be a good partner to a researcher. So I don't know, Jaymie, what you put some stuff in the chat as well. Topics are relatable to the planning period for the implementation science project. Yeah, you guys made some of those points early on, but yeah. Are there other questions for you guys that you want to put to either the National Council, me, the presenters? I will say that we are, I want to call out that we're asking you to do an evaluation of this session. And so Allison put it in the chat about 3 statements ago. So if you could find that, or Gary or Allison, drop it back in for people, we'd really appreciate it. We're coming up to the last minute. So you are always welcome to email us. Guidance, feedback, all of it. Really would appreciate that from you. And I just want to remind you that next month is Allison Metz. Many of you know her from NERN and now at UNC Chapel Hill's implementation research work. She'll be the presenter along with Christina Dobson, who is a partner for her, who's been doing implementation science projects for a number of years. And the topic is implementation strategies, selecting and tailoring strategies to improve outcomes. So continuing to build on this readiness to do to really start your implementation science projects. So we look forward to all of you joining us. Sam, do you have any last words of wisdom for everybody? I want to get them out on time. So you've got 1 minute or less.
No further words of wisdom. I just want to thank our presenters today. And I think to the kind of question that you brought up, Mary, I think this is like the kind of questions that we want to continue to talk through too, is like, what are the use cases for application of these best practices? How do they get integrated within the research too? I think that's a really important thread that we need to be making throughout all of this.
All right.
Yes.
On that note, always happy to see all of you. Thank you for coming.
Thank you for joining this month's Learning Community session. Please take a few moments to complete the evaluation for this session using the following link being posted in the chat. We hope you join us again for next month's Learning Community session.